If you are watching this, you are likely dealing with a frustrating and painful problem. You feel the urge to go to the bathroom, but when you try, it feels like the opening is simply too tight. You might be straining, feeling pain, or noticing that your stool is very thin, like a pencil. Many men over 50 assume this is just constipation or maybe an enlarged prostate. But if you have had past surgeries, like for hemorrhoids or radiation therapy, you might be dealing with a condition called anal stenosis. In simple terms, the exit has become too narrow. In this video, we are going to move past the embarrassment. I will explain exactly why this happens, and more importantly, I will walk you through a 4-step home protocol using dilation therapy to safely regain your quality of life. So, what exactly is happening? The anal canal is a muscular tube. Normally, it stretches to allow waste to pass. However, scar tissue does not stretch. If you have scar tissue from a previous surgery like a hemorrhoidectomy or chronic inflammation, that scar tissue acts like a rigid ring. Look at this diagram. The sphincter muscles, the rings, are supposed to relax. But in stenosis, the lining is replaced by stiff tissue. This is very common in men over 50 because our tissue elasticity decreases with age. Why does this affect men in developed nations so much? Because we have higher rates of colorectal screenings and surgeries. Ironically, the surgery meant to fix a problem can sometimes cause this tightening during the healing process. Before we treat it, let's confirm this is what you have. Here are the hallmark signs of stenosis versus regular constipation. Pain at the opening, not deep inside but right at the rim when passing stool. Thin stool. Does it look like a ribble or a pencil? That is the mold of the narrowed opening. Incomplete evacuation. You feel like you still need to go but physically can't push it out. Laxatives don't help much. You make the stool soft but it still hurts to pass. If this sounds like you, mechanically stretching the area, dilation, is often the gold standard treatment before considering more surgery. Now let's talk about the solution. Anal dilation. This is not about sexual play. This is a medical therapy to remodel scar tissue. Think of it like physical therapy for a stiff shoulder, but for your pelvic floor. Step 1. Sizing. Don't start with the size you want to be. Start with a size that fits comfortably. If you have a set, pick the smallest one. It should slide in with zero pain. Step 2. Lubrication. Men over 50 often have drier skin. You must use generous lubrication. I recommend a water-based lubricant for easy cleanup. Coat the tip of the dilator and the opening. Step 3. The clock technique. Insert the dilator gently. Once it is inside, do not just leave it there. We want to massage the scar tissue. Imagine a clock face. Gently press toward 3 o'clock. Hold for 10 seconds. Then 6 o'clock. Then 9 o'clock. We usually avoid 12 o'clock towards the spine to avoid urethral pressure. Step 4. Duration. You don't need to do this for hours. 5 to 10 minutes twice a day is the medical standard. Consistency is key. If you force it, you will tear the skin, a fissure, creating more scar tissue. Slow and steady wins this race. There is a second factor here. Men hold stress in their pelvic floor. If you're anxious about pain, you are likely subconsciously clenching your sphincter muscles all day. This is called hypertonicity. While using the dilator, I want you to practice reverse Kegels. Instead of squeezing in, imagine you're trying to gently push the dilator out. Deep breath into your belly and relax the flow. This trains your brain to stop guarding the area. Dilation won't work if your stool is hard as a rock. You need to aim for a type 3 or type 4 on the Bristol stool chart. Soft and formed. In Germany and Japan, diets can be high in starch or meat. Ensure you are taking a soluble fiber supplement like psyllium husk. It creates a gel that makes the stool glide past the stricture, narrowing without tearing it. Please listen carefully. If you experience significant bleeding that fills the toilet bowl, sudden unexplained weight loss, or if the narrowing happened very suddenly without prior surgery, you must see a doctor. These can be signs of other conditions. If you have questions about which size dilator to start with, drop a comment below. I try to answer every question. See you in the next video.